Alrighty, hello, and welcome to SCO's January webinar on optometry, a career with vision. Thank you so much for joining us. I hope you all are staying safe and healthy. My name is Avery Cunningham. I am the Assistant Director of Admissions and Student Services here at SCO. I am one of the admissions team members who answers your admissions questions and participates in the admissions process. Before we get started, I ask that we all use proper Zoom etiquette by keeping microphones muted unless speaking, limiting background noise, and respecting all of this webinar's attendees and facilitators. We will have time for questions towards the end of the webinar, but if you should need to communicate with us immediately, please use the chat feature, which is either at the top or the bottom of your screen. Today, we're going to be talking about optometry, a career with vision. So it's going to be an opportunity for you to get a pretty thorough overview of what optometry is, the types of opportunities within the field, before you hear from our guest facilitators, Dr. David Hall, who's a faculty member and assistant professor here at SCO, and Landon Powell-Goodwin, who is a current student in the class of 2027 here at SCO, where they're going to talk about their experience discovering all that optometry professionally has to offer. Finally, this webinar is being recorded and will be free and available to view starting next week on our website. Alrighty, and with that, we'll go ahead and get started. So what is an OD? What is an optometrist? Well, in a very general, basic sense, an optometrist is a primary care provider. But to get into more specifics, they examine, diagnose, treat, and manage ocular diseases and disorders and injuries and systemic diseases that manifest in the eye. And that covers so much. I know for so many people, they may view optometry as just, your friendly neighborhood eye doctor that you may see once or twice a year, and there is one on every corner, but truly the scope of optometry is incredibly broad and is growing every day. What I always tell students who show an interest in optometry is that whatever fascination you have within healthcare, within medicine, within humanitarian aid, within technology, within entrepreneurship, you can find an avenue for that through optometry. So that is why we're so excited for opportunities like this, where students can really hear from optometrists about their experience, kind of discovering all of the world within optometry that they can discover professionally. Nearly 85% of all eye health and vision care is provided by ODs in the US, which is an incredible number and is growing every single day. So optometrists aren't just treating the expected patients, they're treating those that have vision issues, health issues, systemic diseases, and they're pretty integral to a person's individual healthcare journey. So many students, when they talk about why they are interested in optometry, it comes down to that ability to be a part of someone's entire healthcare experience, not just someone they see once a year and then never see again, but someone who can have a pretty integral role in their lifestyle. And that's something we'll be just talking about a little bit as we go forward as well. So talking a little bit more about the scope of patient care. Now, the base understanding of what optometrists can provide is primary vision care. That's refractive care, eyeglasses, contact lenses, functional vision care, binocularity, vision therapy, those things that you might expect of an optometrist when the not to be coy, but the vision of optometrists first comes to mind. But then you start getting into things like primary eye health care. That includes eye diseases, high blood pressure, diabetes, infections, injury. So often students discuss as one of the critical moments of their time shadowing or observing or working in an optometric setting, that moment when they see a doctor, diagnose a patient with a systemic issue like diabetes or high blood pressure, just based on their eye exam. And for many, many patients, I know myself included, sometimes I may be very slow to go to my primary care medical doctor, but if something is going on with my vision, I'm never going to neglect going to the optometrist. So in a way, optometrists become almost a frontline healthcare provider for so many patients, since they're able to address needs and issues and diagnoses that patients might not even know that they're suffering from if they're neglecting to see a primary medical doctor pretty regularly. And then there are several subspecialties of secondary care within optometry, such as pediatrics, brain injury, vision rehabilitation, more detailed types of vision therapy, low vision, ocular disease, contact lens, and community health. And these specialties are really just the tip of the iceberg. It's a list that is growing every single day and can really be tailored to a particular doctor's specialty interests, skills, and experiences. So the scope of patient care within optometry is wonderfully large and really does show that this profession is one really tailored for a student's or a prospective student's future. Whatever it is that you're wanting to accomplish as a doctor, as a medical provider, you can really find that path within optometry. So that's a very, very quick introduction and rundown, but I do want to, of course, leave time to dive into our questions with our guests so you can hear some more specialized and specific information. So starting off, we have Dr. David Hall and Landon Powell Goodwin. So if you two wouldn't mind unmuting and just saying hello and introducing yourselves real quick, and then we'll dive into the questions.
Landon, go ahead.
Okay. Hi, I'm Landon Goodwin, and I am a current third-year student at SCO.
Hey, I'm Dr. David Hall, and I'm an associate professor here at Southern College of Optometry. I joined the faculty 5 years ago after 25 years of private practice experience.
Wonderful. All right. Thank you so much. All righty. Let's dive in. So all of these questions are for both you, Landon, and you, Dr. Hall. So if you could just kind of bounce back and forth as we answer them. So starting off, a little more about you. Where are you from and where did you attend undergrad, grad school, optometry school, even for you, Dr. Hall, before you ended up coming to SCO?
Yeah, so I did my undergraduate at Harding University in Searcy, Arkansas. And I'm originally from Oklahoma and Wyoming. And then I went to optometry school at the Oklahoma College of Optometry in Tahlequah, Oklahoma.
I am originally from Kansas City, Missouri, and I just went to the University of Missouri for my undergrad.
Great, thank you. Then if you could both share what inspired you to pursue optometry.
For me, I actually grew up with a dad and a grandfather who were both optometrists. And just seeing the way that my dad got to impact others, especially kind of kids my age growing up that maybe didn't have glasses. Eventually, when they first got their pair of glasses, you could really see that light bulb go off, that they could finally see better. That typical, I didn't realize trees had leaves moment. I got to see that in friends of mine growing up. And then just being able to help others and kind of do something in the healthcare field in general was something that I always wanted to do. And optometry really fit that role while providing me the ability to have a very good work-life balance and support my family as well.
I think what kind of inspired me was I wanted to be in a medical field, but I wasn't sure what part of medicine. And the one doctor I always enjoyed going and seeing was my family optometrist in Wyoming. And he was just a really nice guy. He helped me see better. I was a little nearsighted in the seventh grade, put glasses on me, and all of a sudden I could see leaves on the trees again and that type of thing. But I always enjoyed going into his office. I knew he wasn't going to do anything that was going to hurt, actually. And then he actually brought it up to my mom one day during a general eye exam, asking, I was in high school at the time, and he asked what I was thinking about pursuing. And she said something in medicine, but not sure what. And he said, well, I think you really ought to consider optometry. It has a lot to offer. It's great, for supporting a family. It's great to keep you in the medical field, but not to be getting paged all night long to run back to the hospital. And so he gave me a job, and he gave me a lot of responsibilities in that job. I was a tech for him, and then I helped in optical. And so I always enjoyed that. And watching him And as a leader in our community and somebody I looked up to a lot and that others looked up to a lot, that's kind of what inspired me to pursue optometry specifically.
Wonderful. Thank you both so much. Now, is there a specific optometric specialty that you're drawn to, that you're both drawn to? If so, why?
Um, for me, I was because of my private practice experience, I did a lot of primary care. We were in rural Oklahoma, and so anything could walk in our door at any time. So I fit a lot of contacts. I did a little dabbling in low vision, treated a lot of disease, diabetic retinopathy, um, did a lot of glaucoma treatment, removed a lot of pieces of metal from people's corneas and from their conjunctiva. And then also in Oklahoma, we had the ability to use ophthalmic lasers. And so I used lasers all that time in practice, helping patients that maybe would have had to drive to Tulsa or Oklahoma City, take a day off from work to get those done. Instead, they were just able to come to our office. They knew us, they trusted us, and so they were comfortable with us doing those procedures. So I didn't have any real specialty. I kind of had to kind of be a jack of all trades, which I really enjoyed. I saw people from uh, infants from 11 months old all the way up to I had a patient that was 106. And a very typical day would be seeing anywhere from age 4 or 5 all the way up to age 90.
Well, I feel like Dr. Hall just stole my whole answer. I am also drawn to primary care for all the reasons that he just said. There's so much diversity in what you'll see, in the patients that you'll see, and what may or may not walk through your door, fitting contact lenses, helping people with glasses, treating disease all at the same time. We don't currently have laser privileges in Missouri, but hopefully the dominoes will fall and we'll get there eventually. But that is for all the reasons Dr. Hall just said. I am also drawn to primary care.
Wonderful, thank you. And then how do you feel SCO exposes students to the full scope of optometry?
So I actually feel like this is a really good one for Dr. Hall to follow up more on, but it's his class mostly. It's surgical procedures class. In our first semester of third year, we kind of went through more a little bit about lasers and minor procedures, injections, and things like that. And now this semester, our second semester of third year, we're kind of getting into more of actually performing the lasers. We get to shoot the lasers into the simulated eyeballs. So we really are learning kind of the full scope while also learning, the disease and the primary care kind of aspects of it as well.
Uh, yeah, Landon's exactly right. Like, I think one of the things about SCO that impresses me so much is that our students in the 2,500 or so patient encounters that they get over their 4 years, um, they get to see all sorts of things. We are in a position in Memphis where we get to see all sorts of people from all walks of life. And sometimes it's just routine vision exams where we're prescribing glasses or contacts, but we also have really large low vision clinic, specialty contact lenses, vision therapy, rehabilitation due to trauma and that type of thing. We we see patients in ocular disease. We see teens. We see kids. And as she said, we are giving our students the opportunity to do as much from a primary care standpoint, but also to give them a good experience of being able to do things that are at the very top level of our education. And so, yeah, I think we give students a really well-rounded experience here at SCO, seeing all sorts of patients and all sorts of conditions.
Thank you. And were either of you ever on the fence between optometry and another profession? And if so, what pushed you towards optometry in the end?
Um, for me, I think it's normal for most people, especially in undergrad, that you kind of have an idea of what you want to pursue, and then that may change as interests change, or as you talk to other people, or you talk to your advisors. But for me, it was always pretty well optometry. I may have wrestled with a couple other things within the medical field, and then I also had certified to teach. That was mostly because I think I always knew I had a little teaching in me, which I love to get to do now. But I did it at the time just in case I didn't get into optometry school on the first go, that I had something to back up with, and I thought, well, education would be a good thing to do. So I don't think I ever went full in on a different track. I think it was always optometry for me, and I think I always knew that in the back of my mind. So some of the other things I may have pursued were just in lieu of, well, if I don't get in this time, then I need to have a backup plan.
I also, at one point, just kind of debated between different medical professions. At one point, I thought about maybe ophthalmology, but after kind of seeing the work my dad does and my grandpa did, in the end, it was kind of optometry that really drew me in, just because of the wide scope of what you can do as an optometrist, all the different diseases and conditions you can treat, um, and all the different opportunities you have in the field.
Yeah, Avery, I will add to that. I think she hit it right on the button. I think what leads most optometrists to become optometrists is that as a profession, as a group of professionals, everyone I meet is really about the fact that they really just want to serve patients. They really want to do their very best for patients, and they're very relational people. They don't want to walk into a room and spend a minute or two with the patient and then walk out and have to run through patient after patient after patient each day. I think we're more relational. I think for the most part, we tend to like to have conversation. We like to get to know our patients, and we like to make a difference in their lives. And so I think when she hits it right on the head. I think for so many of us is that she watched a granddad and a dad that took really good care of their patients for generations, and now she's going to have the same opportunity, whether in that practice or another practice. But to be able to make an impact on a family for generation after generation is really a joy, and it's really, I think we all consider it a great privilege. So I think that's what always tipped me back towards optometry.
Wonderful. Um, some may think of optometry as a limited or limiting profession. What would be your response to that opinion?
I do think a lot of students kind of start optometry with thinking that it's just kind of what their family eye care professional does. But after kind of going through school, you see there are so many more options to the field of optometry, such as getting into like the pharmaceuticals, helping with research and development. We currently have research going on campus that we can either participate in, or we have staff doctors that are conducting research to help further the profession. So there are just many, many more ways than people ever think of to get involved in the field of optometry.
Yeah, I couldn't agree more. I said this to Landon's class, and I probably said it to every class that I've taught at some point or another. And I really believe this and see that this is true. I think right now is the most spectacular time, the most just the greatest time to become an optometrist in this country. And it is because as people age, which our population is aging and it continues to get older, but it's also we continue to add population at the same time, the needs are so great. And so I don't see optometry as limited at all. In fact, I see just so many opportunities out there. So whether you want to go into academia, whether you want to, as Landon said, go into research, if you want to do a little bit of both, if you want to work in a VA, if you want to work in a primary setting and own your own office, you can. If you want to work with another group of practitioners in a group practice, if you want to work in a hospital setting, if you want to, I mean, as I talk to people at our national meetings and stuff, I'm always so intrigued to find the different settings that people practice in. And I think, especially with scope expansion really taking off in so many different states, that I think that this is a great time, a golden era of becoming an optometrist. And not just from making a living standpoint, but just finding your niche and being able to pursue that niche is just unlimited right now. So I love that question. I think that's a great question. And I think Landon's exactly right. I think once you get into school and you start getting exposed to different people and different things, then all of a sudden you realize, wow, this is wide open. I can choose any number of different things to have a hand in.
Wonderful, great, thank you. Now, if you could briefly, both of you, discuss your day-to-day experience as an OD, Dr. Hall, and as an optometry student, Landon.
Landon, you want to take this one first as an optometry student, and I'll come back behind you as an OD.
Yeah, that works. So as an optometry student, definitely more of the first and second year. It's been kind of 4 hours in class. First year it was in the morning, and then you would go to lab in the afternoon with your kind of smaller group of 25 to 30 students, be in lab for 1 to 2 hours in the afternoon, and then you would kind of have the evening to do your studying. In second year, it's just flipped. And then most days I would spend studying with a friend, especially certain topics that seemed a little harder to tackle by myself. Currently, as a third year, we're in the big board study era. And so I am in clinic actually much more often as a third year. We have 3 full days of clinic as third years. So we go to class in the morning and then have clinic in the afternoon. But on those 2 days that I'm not in clinic, we actually have it completely off. And so those are filled with board studying for hours and hours. And then kind of in the evening, I take the time to myself to kind of relax and wind down, hang out with my daughter and my husband, and then do it again the next day.
So as an OD in private practice, I usually worked Monday through Friday. I would usually take a half day or sometimes a full day off and work 4 days or 4.5 days. In my time in Oklahoma, we had two different. I was in a partnership with my best friend from optometry school, and so we had two practices, and we would just go between those two practices. So we always tease that we met by phone and text, and that we would cross each other's paths, going and coming from both clinics each day. But we would see generally in one clinic, a newer clinic, we would see 25 to 30 patients in a day. In our other older clinic that was well over 100 years old, we would see sometimes 40 to 45 to sometimes 50 patients in a day. And some of those are very, very quick follow-up visits. Some of them are more lengthy. And so that's what my career in private practice looked like. And I think that's pretty well across the board, probably what Landon's granddad and dad did. Um, as an OD in academia now, which has been a great second half of my career move. I absolutely love what I get to do. Whenever I can hang out with folks like Landon all day, every day, it's just that's a great thing. And so my days now are very different. I may start at 9 o'clock. I may lecture at 8. Start my clinic at 9:30. I may have a morning where I get to do professional development. I may be in clinic that afternoon or a laser lab that afternoon, which allows me to do a lot of different things, which I really have found that I enjoy. I kind of like the fact that my schedule changes just a little bit every day. And then the other thing that really has been a great blessing to me and hopefully to my students that take me up on it, but I get a lot of coffee visits. I get a lot of times to just sit down with students and just visit about life. I always tell all of my students that if you ever just want to sit down and talk about school or life or practice or clinic or any of those things, I'm always available. I'm always going to buy a cup of coffee for you. And then until you graduate, and then you have to start buying coffee for me. But it really allows me to spend an hour and a half with a student and just talk through life and talk through things that are going on. And I think that's one of the things that brings me the greatest joy between patients in clinic. A lot of my students will just come in and we'll just visit. We'll just talk about whatever comes up, whether it's clinic, whether it's clinic, or whether it's their questions about private practice, or whether it's just questions about life or just talking about life. I think that's one of the things that I enjoy most. So I've had that experience through student, practitioner, and now as academician, and they're all just three really good. I don't miss being a student, but the board prep and all that. But even optometry school has so many great memories for me too.
Great. And then what advice would you give to prospective optometry students who want to learn more about the profession?
Go ahead, Landon. You could take this one first.
All right. Um, I would say something that the AOSA is really trying to work on this year and coming up soon is kind of getting students, pre-optometry students, more involved in things like optometry's meeting and academy. So if you have any of those national conferences nearby, or even your local regional conference, to attend those. But even if you don't have the opportunity to attend any of those, there's also this really great resource called optometrystudents.com that the AOSA is really working on building up, pushing out to optometry students. And it's got just articles written by current optometry students, sharing our day-to-day life, tips and tricks, basically anything about being a current optometry student. So I think that can be a really good resource as you prepare for optometry school.
Hey, Landon, do you want to tell them just real briefly just what AOSA is and what your role is at SCO with the AOSA?
Oh, yeah, sure. So the AOSA is the American Optometric Student Association. So it's the student section of the American Optometry Association. And I am the current trustee. So I represent SCO on the national board, where there are two trustees, one trustee and one trustee elect from every optometry school. And so we represent the school on the national level, and then the AOSA represents the students on the AOA level.
Yeah, Landon is one of those students that being married, having a child, being a third year student, and the AOSA trustee. She knows how to balance life really well. And so if you ever want to talk to her about that, she's just doing an excellent job at that.
Thank you, Dr. Hall.
Well, I agree completely. I love all that information that she gave you. So be sure to check out those websites because there's so much now for prospective optometry students that want to learn more about our wonderful profession. And those are all great places. The other thing is go shadow somebody. Go if you have a family optometrist, ask if you can come into their office for a half a day and just hang out with them. Ask them questions. Watch how they do things. Watch how they interact with patients. Watch what they do in an examination room and how they start making decisions. That and talking to actual students, like getting to hear from Landon today, is just great because you really get an idea of what being an optometry student is like, and so, yeah, take all those opportunities, just research. There's so many great places that you can go to get that information, and then just talk to people one-on-one.
Wonderful. And in your opinions, how has optometry grown and developed over the years?
Dr. Hall, I'll let you kind of take this one with a little more experience than me. All that I know is the more recent developments, kind of trying to expand scope of practice, adding lasers, minor procedures, injections, things like that. But Dr. Hall, I'll let you kind of take the reins on that one.
Yeah, I wish we could hear from like your granddad. I think that'd be a fantastic conversation. Yeah, even just in the 32 years that I've been an optometrist, I was telling Landon's class this morning that there are things that were coming out just as we were getting out of optometry school 32 years ago. And my then best friend then became my business partner. We're sitting side by side, and we both looked at each other in the middle of a CE, a continuing education class one day, and we went, "Yeah, that's not ever going to happen." You know, hearing about this new advancement that we thought, well, that'll never happen in our lifetime. Maybe our kids will see that. And sure enough, it was talking about LASIK, which is eye surgery, refractive eye surgery. And sure enough, like 2 years later, I'm having it done and my wife's having it done. So medicine in general is moving at the speed of light, and it seems to just get faster and faster. So just in my career time, we've gone from being able to use diagnostic medications to now being able to prescribe medications, to now being able to prescribe oral medications, to now being able to do injections, as Landon said, minor surgical procedures, lasers, just any number of different things. And so it continues to grow and change and develop. You know, technology is growing rapidly. All those things then combined. I have certain pieces of equipment that that we bought or that we leased while we were in practice, and those little pieces of equipment actually change the way that we treat patients from that point on, like glaucoma or retinal vein occlusions or just refractive error like myopia, hyperopia, nearsightedness, farsightedness, astigmatism. Cataract surgery now has developed so much, and so it will just continue to just speed up and speed up. And so who knows where we're heading to over the next 15 or 20 years. I'm excited to see what Landon gets to do 15 or 20 years down the road if I'm still around.
Thank you. And then our last question, is there a development in the industry slash profession that excites you specifically? If so, why?
Go ahead, Landon.
All right. I think for me and for my kind of generation of future ODs, a really big kind of development is myopia control. I am really excited about the potential to kind of stop the progression, the development of more degenerative myopia. Growing up, I mentioned having classmates that first saw the leaves on trees when my dad gave them glasses. And I had this one friend that was really, really shy when we were growing up until the point where my dad prescribed him his first pair of glasses because of his myopia was so high that he couldn't really see enough to be able to interact with people. And so I think the potential for myopia control and the ability to kind of stop that before it gets that bad, or at least slow it down, is really, really exciting, and something that I think my generation of optometrists will kind of run away with, I hope.
Yeah, that's great. Uh, that myopia control wasn't even on our radar 10 years ago. And to have that ability now is just spectacular. I'm really excited, as Landon said, I'm really excited to see we are a legislated profession, and each state has its own uh, optometry rules and regulations. And though there's some similarity between each of the states, there's some states that are more progressive than others, but they're catching up. And watching states like Missouri, which is right on the cusp of just in the last week or two of getting laser privileges. And so we're adding states all the time with increased privileges for what optometrists can do for their patients. So I think all those things I'm really excited about. I'm excited about the fact that um, I really believe that SCO is the finest institution in the United States. I know that there's some really good optometry schools. I didn't go to SCO, but I can say really frankly that I think that we provide a fantastic education for our students. And I think developing really fine doctors is what we're doing well. And I'm excited to see how they're going to continue to move our profession forward. And then, as I said before, just the way that technology continues to move and move forward rapidly. I'm excited to see what we're going to be able to do for our patients in the next few years, from myopia to control to cataract surgery, implants that can change, the way people see, to new contact lenses that help people that really never had a hope of wearing contacts in the past can wear contacts. So, and then from a medication standpoint, being able to treat more and more disease with better and better medications or lasers or surgical treatments or things like that. And then also, just as I said before, there have been a couple developments in 20 years that literally was technology, things that we have in our office that completely changed the way that we treat patients and think about diseases, including glaucoma. And so I'm excited to see how all those things keep progressing, just all for the benefit of our patients, all for the benefit of helping people enjoy life a little bit more clearly. Because for so many people, that was out of reach for a long time.
Excellent. Well, it's been a wonderful Q&A. Thank you all so much. I do want to go ahead and open it up to questions from our attendees. So for those who are our guests on this webinar, if you have any questions for Dr. Hall, for Landon, for both, please feel free to drop them in the chat or the Q&A feature, and then we'll be able to see them and read them out. Otherwise, while we're waiting on any questions for Landon or Dr. Hall, any last things you want to add while we're waiting for questions regarding the potential within optometry and the opportunities that prospective students may have within the field?
No, I can't think of anything else that I would add.
I agree. I think all your questions pretty much covered it all that I can think of, Avery.
All right, wonderful. We did have a question come in from Madeline. What does the low vision specialty include?
Landon, do you want me to take that one?
Yeah, you go ahead.
Okay. Um, Actually, I have a low vision specialist on their way to my house for dinner tonight. Um, so low vision specialty really includes a lot of different things. It's not only treating underlying disease, which a lot of times for folks that have low vision needs, and low vision doesn't necessarily mean that they can't see anything. It just means that they've reached a level where they're having trouble seeing to do certain things. And the state usually specifies what low vision would be stated as. But it generally is helping patients not only treat their underlying disease and to check family members because some of these are genetic diseases and make them aware of those, but it's also fitting them with whether glasses or contacts or fitting them with other external devices that might help them to do specific things in their world. I think it's one of the areas of optometry that can really impact a patient to the point where they're in tears because somebody that has not been able to see a grandchild walk into a room and then all of a sudden with the telescope in front of them they are able to see that grandchild, or somebody that would like to read a normal book again, and being able to use some sort of a magnification device to do that is just life changing. And then the other thing that they really help is they help patients learn how to function better in their world as a low vision patient, a patient with low vision. And so it kind of entails all those different things. Um, it's just one of those that I think can be very life changing for patients.
Great. And then we had a question from Jason. What recommendations do you have for someone looking to apply to optometry school in the next 8 to 10 months, other than the obvious, such as chopping away at prereqs and shadowing hours?
I would say that getting involved in undergrad as much as you can, kind of joining professional clubs or educational clubs, as well as kind of looking into different specialties and definitely looking into different schools, kind of figuring out what you want out of an optometry school. Maybe that's looking at the board passage rates, maybe it's looking at the class size or the clinic size and the patient population, so that you're not kind of spending your time applying to all 30 optometry schools, but you're kind of narrowing down your options kind of a little earlier to kind of figure out where you want to be and what you want out of your optometry school education. I think that could be really helpful.
All righty. Any other questions from our guests? Post them in the chat. All righty. Okay, so with that, this brings us to the end of our webinar. I know we have covered a lot of information this afternoon, but I do hope this has all been of assistance to you as you start on your optometric journey. We look forward to seeing you in February for our next webinar, which will be hosted now and forevermore by our new Student Services and Admissions Officer, Tara Pinnell. If you haven't done so already, I invite you to request more information by signing up for our inquiry form. You will receive a personal advisor and a personal brochure with information relevant to your goals and experiences. Thank you so much, Dr. Hall and Landon, for sharing of your time and insight. For all of those of you who are in the path of this very serious winter storm that is bearing down on all of us. Please stay safe and stay warm. Hopefully we'll see you all next month. But in the meantime, take care. Thank you, everyone.